and I'll show you the room. Hi Cole, my name's Nathan. I'm going to be doing an abdominal assessment on you, if that's okay.
Sure thing.
Okay. All right, first thing I'm going to do is wash my hands. And I did collect vitals on Cole before we started this. His heart rate was 72. His respiratory rate was 14. Oxygen saturation was 98% on room air. And his blood pressure was 116/68. Temperature was 98.8 axillary. So first thing I'm going to do, so when Cole walked in, his gait was steady. He's well groomed, takes care of himself well, appears as stated age. Now looking at his skin, he has no cuts, scabs, bruising, or ulcerations noted. His skin is appropriate for ethnicity, and it is warm. His skin turgor is elastic. Okay. So Cole, what I'm going to do is I'm going to look in your mouth here first, look at a few different things, okay? So all I need you to do right now is just open your mouth for me as wide as you can. So looking, his mucosa is pink. His buccal space is pink and intact. Can you say ah for me?
Ah.
Okay. He does still have his tonsils. They are pink and intact without redness. One more time, say ah.
Ah.
Okay. Able to visualize the pharynx. It is pink and intact. Looking at his teeth, his dentation is good. His teeth are all intact. Okay. Alright, so now what I'm going to have you do, Cole, is just lay down on your back for a minute for me.
Okay.
Alright, so looking at his abdomen, there's no obvious ascites, there's no pulsating masses that I see, no visible peristalsis as well. Alright, Cole, so what I'm going to do here is I'm going to listen to your abdomen in all four spots here. I'm going to listen with both the diaphragm and the bell, okay? So all you have to do is just breathe normal for me.
Okay.
Alright. Alright, so I have active bowel sounds in the right upper quadrant. Got active bowel sounds in the left upper quadrant. Active bowel sounds in the right lower quadrant. And active bowel sounds in the left lower quadrant. I'm going to listen again with the bell of the stethoscope. Got active bowel sounds in the right upper quadrant. Got active bowel sounds in the left upper quadrant. Active bowel sounds in the right lower quadrant. And active bowel sounds in the left lower quadrant. So now, Cole, I'm going to listen for, over your abdominal aorta and your renal arteries, as well as your iliac arteries and your femoral arteries, okay? So same thing, you can just breathe normal for me. So I'm listening over the aorta. No bruit noted. Listen over the left renal artery. No bruit noted. Right renal artery. No bruit. The right iliac artery. No bruit. Left iliac artery. No bruit. The left femoral artery. No bruit. And then right femoral artery. now I'm gonna try the scratch test to identify the edge of your liver here. So now what I'm going to do is I'm going to percuss your stomach. So I'm going to put a little bit of pressure with my hand and I'm going to kind of tap it, okay?
Okay.
Alright, we got tympanic resonance. So now what I'm going to do is I'm going to palpate your stomach lightly here to start, okay? Just let me know if there's any pain or pressure, anything, anywhere. Any pain through there?
No.
Okay. So now I'm going to do the same thing, just deeper palpation, okay?
Okay.
How's that?
It's a little more tender, like in like the middle.
Middle?
area.
Like right here?
Yeah.
Okay. Alright, I'm going to check for rebound tenderness, so I'm going to put pressure here. Did that make it any worse when I let go?
It was about the same.
About the same. Okay. Okay. So now what I'm going to do is I'm going to palpate your liver. So what I'm going to have you do is just take a big deep breath. You don't have to hold your breath, but just take a normal deep breath here. Not able to palpate the liver. We'll do the same thing over here with your spleen.
Okay.
So the same thing, take a deep breath. Yep. Okay. Unable to palpate the spleen. So now I'm going to try and palpate your kidneys here. So we'll do the same thing again. I'm going to put a little pressure under your back here. Same thing, and pressure on the top, okay? Unable to palpate the left kidney. I'll do the same thing with the right here, okay? Unable to palpate the right. Now, would you be able to sit forward for me? And I'll have you sit over there for a second.
Okay.
So I'm going to check for costovertebral angle tenderness. So what I'm going to do is I'm going to stick my hand here, and then I'm going to strike my hand, and just let me know if there's any pain with that, okay?
Okay.
Any pain with that?
No.
Okay. We're going to do the same thing over here on the left side.
Nope.
Any pain with that? Okay. Alright, well you can come back over here now. Alright, Cole. Well, with your age group, one of the biggest risks is motor vehicle accidents. So one recommendation for you would be to always wear your seatbelt, don't drink and drive, and obey all safety laws, okay?
Okay.
Alright. Well, I appreciate your time. I'm going to wash my hands, and I'll give you some time in the room, okay?
All right. Thank you.
Alright.